Does that sound or look like your dog? Well, if you have an English Bulldog, Pug, Boxer, or a Shih Tzu, you're probably all too familiar with that. Dr. Carlos Aragon is a board-certified specialist and surgeon at Affiliated Veterinary Specialists. He brought along his dog, Colby, to fill us in on some of the respiratory issues that you might be seeing in your pet, especially as we get into the summer months and some of the treatment options. But first, welcome. Good to see you.
Thank you so much.
So let's talk about Affiliated Veterinary Specialists for those people who might not know what you guys are all about.
Absolutely. So AVS is a group of board-certified specialists that team up with family practitioners or family veterinarians to tackle tough problems. So if your veterinarian has a challenging surgery that they want to refer, they'll send you to a specialist. We've been providing service for over 20 years here in North Florida, South Georgia communities. And we do all kinds of things from surgery to rehabilitation. We have a couple anesthesiologists on staff as well to maximize the safety of anesthesia and the quality of pain management. So yeah, it's a great group.
And is that what sets you apart from other veterinarians, is that you guys are specialized in your trade?
Exactly. Yeah, so we're referral only. So we did an additional, anywhere from about 11 to 13 years of school to become a board-certified specialist after becoming a veterinarian. Okay,
before we get to Colby, who's so cute sitting on your lap, let's talk about your role specifically and what you are trained to do with them.
Yeah. So I'm a board-certified surgeon. I'm one of the owners of AVS, and we started as one practice in Orange Park just over 20 years ago, and now we have 4 centers in the region. So we have one on Southside and Beach, one in Orange Park, which is the one I work at, and then one in Daytona, actually, and Gainesville as well. And so it's a great group. We have over 100 staff members, and we started with 3, so it's pretty
wow,
exciting.
It's really grown. Yeah. Well, the need is out there. There's a demand for having specialists because, Lord knows, if anything ever happened to my 2 dogs, you would want to make sure that they're in great hands. So last time you were on the show, we talked about respiratory distress in dogs, but specifically today we want to talk about one certain type of that, especially things that affect dogs like Colby here.
Yeah, exactly. So 'tis the season as it becomes more humid and hot outside. These type of dogs right here, so brachycephalic dogs, which means the short noses, stouts. So you're talking about English Bulldogs, Pugs, Frenchies, Bostons, Boxers. They are born genetically with a very shallow airway, and so as it becomes hotter and more humid, they can have difficulties breathing, and that can lead to secondary high blood pressure of the lungs over years, and then tertiary heart failure. So it's something to really identify. A lot of owners will have an English Bulldog or a Boxer or a Pug, and they talk about how bad they snore and how when they go for walks they have difficulties because they're struggling to breathe, and that's something that's very fixable, in fact.
Okay, well, let's talk about that. First of all, the warning signs. Is the snoring a warning sign? Because some people say, oh, I just have a Pug or a Boxer, that's just what they do. Or is that a sign that you should be really concerned?
No, it's a warning sign. It's like sleep apnea in people, in fact. So it's been shown that these dogs have very similar syndrome. They got a lot of redundant tissue at the back of the throat, an elongated soft palate, a very narrow nostril opening, just a tiny little slit, and dogs are nasal breathers. And so when they have their mouth open, they're panting, moving dead space, they're actually not breathing.
Oh, really?
They breathe in through their nose. So if their nose is barely open and the soft palate is redundant or very long in the back of the throat, it will close off while they're sleeping and they'll wake up. It's been shown they'll wake up every 30 to 60 minutes. And so it's a very similar syndrome in
So
dogs.
let's talk about how we fix it. What is the remedy for this? Because you just said, interestingly enough, we can fix that.
It is, yeah, very fixable. So Colby, actually, she's my dog. We did her surgery a few months ago, and the first thing we do is open up the nostrils right here. So these nostrils, hers were very narrow, so just a small little line that they can breathe through. We go in and do what's called a ventral wedge. So we widen the nostril opening so they're able to get more air in per unit time. And then at the back of the throat, we trim off part of their soft palate. So the soft palate tends to divide the nose compartment from the oral compartment, and it'll get stuck in the back of the throat, and that's what contributes to the snoring and the raspy breathing, and so we'll go in and trim it off. It's a lot of redundant tissue, and then that will open up the whole airway, and they're able to breathe much better.
And how is Colby doing now? post-surgery.
Dramatically better.
And
yeah.
how so? What are some of the things that people can notice with their dogs?
Well, she's more active. She's more lively. She's able to go on longer walks. She snores less.
That's good. That's
Yeah.
good for you guys,
Yeah.
especially if she's sleeping in your room,
Exactly.
right?
Exactly. Yeah. No, we had to move her out. That's for sure.
Yeah. We got to get that surgery. Well, thank you for being here. We
absolutely.
appreciate it.
Thank you for
Thanks
having
to
us.
Colby for taking the time to come over here and behave just so wonderfully. We appreciate it.
Yeah.
And we also appreciate affiliated veterinary specialists for sponsoring the segment. For more information, you can visit avspethospitals.com. You can also call the Jacksonville office. Like they said, they have multiple locations. Jacksonville is 904-646-1287, or Orange Park is 904-278-0287. Still to come after the break, why some